Hi, I'm Dr. Sandra Gothard. I'm a co-founder of Village Health Partners, and I have a special guest today because I wanted to bring a face to some of these numbers that we're seeing on patients affected and infected with COVID. And would you mind introducing yourself, Jim?
Hi guys, I'm Jim. I'm a relatively healthy 66-year-old male. I live in McKinney, Texas. And late March of this year, I was diagnosed with COVID. I spent 14 days in the hospital, 8 of which I was on a ventilator. I nearly died because of this disease. Came through it, I was released, and at that point I went home for about 10 days and developed pneumonia because of this. Went back in, was re-intubated, actually went through surgery. And with that, I'm just here to sit with the doctor and talk to you about what you guys need to do to take care of yourselves. It's important that we do wear masks, we wash hands, we socially distance. Sometimes the statistics of this really don't show you what happens, and the reason why I'm here is to give you my story.
What it's like to get infected and the emotions of having a machine breathe for you for 8 days in a near-death experience.
Well, my whole process was, I thought I had a sinus infection. That's why I contacted your office, because I'm susceptible to those. I thought that's what it was, but about an hour before my televisit, my fever spiked. And with that, we decided to go ahead and get tested, and that happened, like I said, on the 21st of March. I then gave it to my wife. It's one of the things that bother me the most. She has some underlying health issues. She stayed at home for 14 days and got through it, no issue. I actually fell off the cliff. I really don't remember being initially intubated, but I was still on the breathing machine when they brought me out of it, when I became conscious again. I couldn't even say the word thank you to my nurses because I had this tubing down my throat. I don't remember what these people look like because they were wearing the PPEs, the plastic. I didn't know their color of their hair. I couldn't see their face. They were completely wrapped in that blue plastic. As I said, a human body being in bed for that length of time, you lose all sorts of strength. I couldn't even get out of bed to go to the bathroom. I literally had to have 2 people help me get up. So what I did is when I got out, I started going to physical therapy, and they started working on my overall strength. And I've been doing very well. I've gone now probably 22 different sessions to do this. Still not at 100%, but I'm getting better and feeling good. I'm still doing my breathing exercises, and it was scary. Before this happened, I was immortal. I think a lot of people feel that way, that I'm not going to get this. I felt that way, but I stepped up to the edge and nearly died because of it. Few simple things to do, people. Wear a mask, wash your hands, social distancing. You don't want to give this to someone you love.
Jim, I think you hit on a great point. The reason I wear a mask in the office and when I have to be outside of my house is I don't know if I'm a carrier of this. And the statistics are really clear. Wearing this thing protects my patients or family or friends if I happen to be out, which I try not to be. But it protects those people from me. And I'd like to there's not, I think there's a reason you and I are both wearing a mask right now. We're both around 6 feet apart. We both washed our hands because it's very hard for us to transfer this disease. And that's another comment. When we spoke yesterday, there's also a reason why you're taking precautions, even though you've tested positive for antibodies. So do you want to share with us why you're still so protective of yourself and others?
As you mentioned, my blood was tested yesterday. I found out the results today. I do carry the antibodies, but we don't know enough about this disease to say that this is going to be a long-term process. And I don't want to be in a position where I'm going to get sick again. I don't know how I'm going to go through that. It frustrates me to see someone out and about without the mask. It's an act of kindness. It's not an infringement on my freedoms. If we decide that we want to help each other, why can't we do something that simple?
So just to clarify, out of our 400 plus patients that had it, most are managed at home just fine. And it's fluids, it's Tylenol, it's rest, it's following CDC guidelines. So Jim is kind of one of our few who actually needed to be hospitalized, and even fewer that need to be intubated. But I think if you heard him loud and clear, for these cases, this is 4 months ago that you had your disease and your surgery, and you're still recovering. So just an awareness to wear your mask, distance.